Hello, I'm Bo Biggs and this is Kim Jernigan. We're the co-chairs for the Pensacola 2017 Mission of Mercy event. Welcome to Pensacola. Thank you for volunteering.
This is the signature event for the Florida Dental Association Foundation, and we are so excited to have you take part in this event. We plan to treat 2,000 patients in our community, and we'll do that because you're going to come and help us, and we're going to restore dignity and alleviate pain for many of the citizens of our community. Thank you for planning to be with us March 24th and 25th in Pensacola, Florida.
Plan to have a great time. It'll be a very rewarding time providing care for those in need, but I guarantee you will also have fun.
Go team!
Go!
Hello, I'm Oscar Menendez, Co-Clinical Director of the Pensacola Moms event. I'd like to thank you for volunteering and would like to go over some important information with you. I'm in charge of the clinical treatment areas and would like to go over the manner in which we have it set up. Before the event, you will receive different clinical protocols that are specific to where you volunteered. Please familiarize yourself with these and the site plan so you will know where you are going and what you are doing. The treatment clinic will be in Building 7 and consists of the following areas: oral surgery, restorative, prosthetics, endodontic, pedodontic, hygiene, sterilization, and supplies. The clinical lead for each section should have previously sent you the appropriate information for your section along with other important information that you should know before arriving. After you have checked in at volunteer registration, picked up your shirt and name tag, you will proceed to Building 7. Find your area and check in with your clinical lead who will be there. He will go over the pertinent information with you in respect to handling the equipment, clinical protocols, clinic safety, instrument handling and sterilization, the communication cards that are being used, and emergency procedures. Your lead is there to assist you, guide you, and try to make the event as pleasurable and rewarding for you as possible. That being said, please do follow your clinical lead's instructions. A lot of time and hard work went into them to make this a safe, productive, and rewarding event for you and others. Thank you very much.
Hi, I'm Dr. Susan Byrne. I'll be in charge of this year's sterilization at the Mission of Mercy event. I want to thank you all for volunteering to work in sterilization this year at the Mission of Mercy event. If you're registered to volunteer in sterilization, you must have your hepatitis B vaccinations. If you do not, please let our head lead volunteer, Dr. Cecilia Hines, know so she can redirect you to work and volunteer in another department. During this event in sterilization, all volunteers must wear masks, gloves, protective eyewear, and gowns, which will be provided for you. No open-toe shoes will be allowed. Anybody touching contaminated instruments must wear heavy-duty utility gloves, which also will be provided, and gloves must be worn by anybody touching dirty instruments. We will split volunteers up into dirty instrument volunteers and clean instrument volunteers. If you are a dirty instrument volunteer, you will clean instruments, bag instruments, and load the sterilizers. The clean instrument volunteers will turn the sterilizers on, unload them, and sort them back into the appropriate bins to be redistributed throughout the clinic. The protocol is in written form. It will be emailed to you before the event so you can review them. If you have any questions, you could email the ADA or email myself at sbyrne1538@gmail.com. Our protocol will be as follows. When instruments are brought to the sterilization department, they will be brought to a dirty area or the used area, which then the dirty instrument volunteers will take. They will be inspected to make sure everything is only instruments, that there's no cotton rolls, teeth, sharps that need to be discarded. They will then be run in the ultrasonic for an appropriate period of time. Then they will be dried and bagged or placed in cassettes, which are already predetermined with a certain color. Hygiene is purple, green is restorative, and blue is for oral surgery. Doctors' instruments will be placed in paper pouches and labeled with their names. If not, they will go in nylon pouches or the cassettes. The dirty instruments that are then bagged will be placed on trays and loaded into the sterilizer by the dirty instrument volunteers. Clean instrument volunteers will then close the sterilizers, turn them on, and run in the pouches mode and run for the specified period of time. They need to be allowed to dry for at least 10 minutes after the sterilizer opens so they do not overheat. The clean instrument volunteers will then remove them using the pot holders that are provided. They will then make sure that the bags are not perforated and that they look like they have been sterilized properly. Then they'll be sorted into bins, which will be labeled with the instruments of what goes in that bin for what area. If instruments are returned to our department and they're not used, they are to be inspected, make sure the bags aren't torn or ripped. If they are, they need to be rebagged and re-sterilized and then re-sorted into the bins to be reused in the clinics. And hand pieces that are returned to us need to be wiped down with alcohol wipes, which will be provided, and then bagged and sterilized as appropriate. In order for sterilization to run in an efficient manner, please follow the protocols that are on the written form so that we basically do not get the other clinics backed up waiting for instruments to be sterilized. Also, please do not let assistants, doctors come and take more than the necessary instruments that they need so that we don't have a problem with other departments hoarding instruments that other ones need. This way that we can have a good running of the sterilization department and nothing gets backed up.